Today we're going to be talking about the Hana Table. So I have put together the Hana Table for you, but when it comes, there will be a package with this material in it. This is the headrest for the patient. We have some foam that will go under the arms, the safety straps. The straps itself, the Velcro piece actually fully comes off, so it won't be on the correct way. You'll need to take it off and readjust it, so there's enough Velcro to go around the arm. And then the padding for the post, which needs to be pulled all the way under the post itself. And the padding for the joints on the bed, which just wrap around. You can tell if the bed is plugged in by the control panel with the lights being on. And this also has a femur lift, so depending on which leg you're doing is which one it is. So this would be for a right total hip, or you turn the knob and it'll go to left total hip. This is the pedal for the femur lift that the physician will use, so as long as you have the knob turned to the correct side, it'll control whichever one just by pushing up and down on it. The femur lift pedal plugs into the bed, so just make sure it's secured here, and make sure before the patient is moved onto the bed that the wheels are locked, which is in this down position. There's a few different topics that we're going to cover on this. First of all, the boot, which I'll show you momentarily, sits in here and is locked into place using this screw. You also have Protraction, which is just very large traction. It can move the entire length as much as the hip will allow, and is locked down using this turn method. It is labeled lock and unlock, so you know which way to turn it. Traction is down at the end, and that is done by turning this knob. And there's also internal and external rotation, which is marked using a 0 to, I believe, 180 system. So it's unlocked with this knob at the top, and as you turn, you can see different markings that are marked with a white line, which will give a better shot of. There's also a lock here. It's marked lock and unlock. When you lift it up, you can lower and raise the leg and move it side to side. So you'll be wrapping the patient's foot with cobia before you put on the ski boots. So just take it and you wrap so that it falls straight off of it. Thank you. Thanks. Very cooperative patient. And you want to go high enough so that the boot doesn't irritate the skin. And try to keep as many wrinkles out of it as possible. Yeah. And you do want to leave the toes exposed. Each of the boots is marked with which side that they go to. So this is the left boot and goes with the patient's left foot, which is the operative side since it's wrapped with cobia. And you'll take them, you might help. Yeah, okay. My patient is helping me, they usually won't. You'll take them by the foot. It usually helps to have two people, one to hold open the boot and one to slide it back. And there's a notch back here that you can check to make sure the patient's foot is all the way in the back of the boot. And then if you've ever skied before, they stamp on just like ski boots. You slide in, and then in order to lock, you crank it up. So too tight. Make sure that the plastic piece stays on bottom. And you can check to make sure it's not too tight if you can squeeze two fingers down here. Okay, so then you'll put the post in place while the patient's head is up at the top. And then you'll use yourself and another person to move the patient down against the post, which will help stabilize them. Thank you. Once the patient's in position, then you'll go ahead and help them get their feet into position. So you'll release the traction so that it's free, it freely moves. And you'll take the patient's foot and place the end of the boot into the spot. There we go. And lock it in place. And you'll do that on both sides. After the patient's in position, you'll remove the board. It is heavy, so be prepared. And then you can adjust the hips in where they're supposed to be. When the doctors ask for some traction or to pull on the sleds, they're talking about this portion right here. So you'll be draped out about here, but you'll be able to see your numbers at the end and be able to reach under the drapes to move here. To move the patient's leg up and down, you'll unlock and just raise and lower. When they ask for adduction or adduction, it's when you drop the leg all the way to the floor and it hurts. Okay? And then you move it in. And a patient that's asleep and relaxed, you should be able to go all the way to the floor and all the way underneath the opposite leg. Internal rotation depends on which direction that you move this, but you're obviously moving the foot in. External rotation, you're moving the foot out. So just be aware of whichever foot, the direction in and out changes. So you won't always be going in, or you won't always be going right, it's be going in. Okay, so sometimes when they ask you to put on the protraction, they'll ask you to move it somewhere and to lock it, which you would do just by twisting this knob. If the patient is locked in traction, you cannot drop their foot to the floor or do adduction. You want to make sure that this is loose, so see how it doesn't move here? Unlock it, make sure it's loose before you drop them to the floor. You can cause serious nerve injury if you don't.